have you been living with bad feet just to avoid painful foot surgery? The experts say things have really changed when it comes to surgery. Podiatrist Dr. Neal Frankel is joining us to bring us up to date on some of the new procedures. Thanks for joining us.
Hi, thank you.
First of all, let's talk a little bit about foot health. Is it tough to keep your feet in good shape? Should you be going to the podiatrist all the time or regularly, I should say?
I mean, certain classes of patients should be doing it on a regular basis, like diabetics and patients who have poor circulation. But everybody seems to have a thinking that foot health is something that's going to be caused by their shoes, and shoes cause a problem. In reality, most of the problems we see are hereditary in nature.
Really?
And
Even
nothing
bunions?
to do with shoes.
Those are
Bunions,
hereditary?
flat feet.
Really?
All hormonal, sometimes hereditary,
Really?
but very rarely does it cause by shoes.
So when we hear all about these high heels and everything, we should, like, we're going to get them.
You're going to get them, you're going to get them anyways. It makes no difference.
Now, bunions, a lot of people have them, and the surgery is not as bad as we think, right?
The newer procedures out now can get you back on your feet within a couple days. You're not laid up with very minimal pain, and some of the new techniques involve minimal scarring.
Really?
So you're not able to see that they had surgery done. You're able to put your heels on, and you're not embarrassed to wear heels.
You have to wear those big feet things, though, big shoe things.
A couple weeks, but really does not involve you being laid up at all.
And we take a look. This is after the surgery. We showed it a little bit before how it looks, and look at the difference. It's like they never had a bunion at all.
And you can see that there's very little to no scarring. You can't even see the scar at all.
Where's the scar, on the bottom of the foot, or where do you?
It's on the bottom, underneath, so that basically when you're wearing a shoe or a heel, you don't see anything. It's all dissolvable sutures.
So is it okay to go back to your 2-inch heels after that?
3-inch if you like.
Really?
Yeah.
And you won't get another bunion?
Well, depends. It depends on if you're hereditary, if it's in your nature. But however, there are procedures that can prevent you from getting it once you've had it corrected. Such as certain inserts that can be made that will kind of balance out your feet so that you're walking in a straight line. Instead of what we call the collapsed foot, which actually many people have.
And we've got a picture of the collapsed foot too. Mine kind of goes like that, actually.
Right. Now, if you could take a look at the left, you can kind of see the before and the after. And the newer procedure is called the one-step, or we use a small implant which goes into the foot and basically stops them from rolling their foot over. That rolling over is actually what causes the bunions and hammer toes and other problems.
Now, insurance, will that cover mostly?
Yes.
Okay, that's good to hear too. Now, talk a little bit more about the flat foot. A lot of people have flat feet, but you have a new implant that can kind of lift it up a bit, right?
Yes, that is correct. In the past, the procedure was to cut the bone, put a screw in, fuse it, but now we use a small little implant. If you can see this thing,
it is.
It's about the size of a vitamin. And this inserts under the skin. There's no cutting of any bones. The patient can walk right away, and the foot can be corrected from a flat foot to a regular arch, where you basically are pretty much walking within a matter of days.
Matter of days? Oh my goodness. Well, this is good information.
2 weeks, you're back in a regular shoe.
Oh, well, you've just helped a lot of people out, I'm sure, who are watching it. If you want to know more information, contact you, Dr. Neal Frankel. Your address, 30 South Michigan Avenue, Suite 302, Chicago. There is your phone number and your zip code, and you can learn all about this, right?
Yes.
Thank you so much for coming in.